Good morning. My name is Suzanne Weber.
I'm Michael Weber. It's really a pleasure for us to do a testimonial for Dr. Chalnick because he's such a wonderful person, a wonderful surgeon, and I just wanted to tell people about the success that we've had with him over the years.
I can walk and chew gum, and I can do the treadmill, and we have stairs, and I can run after my 2-year-old granddaughter and play with her on the floor, and I can actually get up off the floor, which I was having trouble doing.
And you can cross your legs.
I can cross both my legs. Would you like to see me cross my other leg? No. Okay. Yeah, I'm good to go. My name is Suzanne Weber. I had a hip replacement. It was performed at Monmouth Medical Center August 24th, 2020. Well, around March, I had been walking very vigorously on the treadmill, and I developed a pain in my groin, and I thought it was from pushing myself on the treadmill. And I went on virtually unable to get into my car. It hurt so much. I tried heat, I tried ice packs. I spoke to people. My brother's very athletic. He said, well, it sounds like a groin pull. And then maybe 6 months later, I spoke to a friend of mine and I described my symptoms. And she said, I hate to tell you this, but my husband had the same symptoms and he needed a hip replacement. So I try to process that because I've never really had surgery. And I went to my dear old friend, Dr. David Chalnick, who is practically like a nephew to me. And he said, took x-rays. He said, I'm sorry to tell you, but it's very bad arthritis and the whole ball and joint is eroded and it's going to never get less painful. I looked at my husband, I said, I'm not having surgery. This is crazy, you know, especially at my age, and I have type 1 diabetes, so I was concerned about the healing and the other aspects of it. And David said to me, if you wait until the spring, and there's no guarantee that the hospital won't be overrun with COVID patients, you will regret it, and after the surgery, you will say, why didn't I do it immediately? So I thought it over, and I spoke to a few people who said the hip replacement is the easiest. It won't take that long. You go to rehab afterwards and you'll be good to go. So 3 days later I called David and I said, make me an appointment at the hospital. And he said, come in, and he x-rayed me again. He gave me a prescription to go to Cooper Rehab, Twin Borough on Route 35 for prehab. And I had maybe a month and a half of prehab. It really put me through the paces so that the musculature surrounding the hip would get stronger. I came home and within a week I had a rehab person, I had a visiting nurse. The rehab and the progress was spectacular. I mean, I didn't even take the oxycodone, I just took extra strength Tylenol. And I was able to sleep and I used the walker to navigate the house. I never used the cane. I went straight from the walker for about a week to just walking normally, you know, carefully but very normally. He's spectacular. I mean, he really knows his stuff. I don't know that I would have, you know, had surgery with anybody that I didn't trust as much as I trusted David. He's very pragmatic. He tells you the truth. He told me exactly what to expect. You know, he made a very good recommendation, which I followed because I trust him. And, you know, I forget that I have a piece of titanium in my body. If you need hip replacement surgery, do it with David. I could never do that much. I'm not athletic. I was raised as a girl in the 50s, so there's not a lot of spectacular athletics. But I can walk and chew gum. And I can do the treadmill, and we have stairs, and I can run after my 2-year-old granddaughter and play with her on the floor, and I can actually get up off the floor, which I was having trouble doing. I can cross both my legs. Would you like to see me cross my other leg? I'm good to go. It's a miracle. And the scar, even the scar, which, you know, is maybe 8 inches, it healed very quickly. I mean, I don't go on Google and ask 30,000 medical questions. I trust my doctor, and that's the story. Anybody who's suffering should end their suffering and go through maybe, I would say, 2 months of discomfort, including prehab, surgery, and rehab, and then you're good to go.
Michael Weber. I had a partial knee replacement. I had had 2 surgeries long before I knew David on my knee. First I had joint mice from athletic injuries, and the second surgery was in, I think, 92, pre-David, and they took out all the cartilage, so it was bone on bone. And from that time on, I had pain in the knee. And I used to go to David, and he used to give me shots. At the beginning, each injection lasted maybe 3 years without pain. So I had maybe 3 or 4. In 2019, we were going to Europe, and I wanted to make sure I didn't have any problems. So I went to David, I would say about 4 weeks before the trip, and got another shot. And this time it didn't last at all. On the trip, we did a lot of walking, and one day we were going to the Picasso Museum in Barcelona, and I couldn't walk. The pain was so severe. And I promised Suzanne, by the time we get back, I'm going to go to Dr. Chalnick, I'm going to have the surgery, you'll never have to go through this on another trip again, I promise you. So about a month later, I went to Dr. Chalnick, and he said, okay, he did the x-ray. He said, I think we could do a partial, which would be a lot easier than a full. We did 4 weeks of prehab. Dr. Chalnick is a great believer in building up the muscles around where the surgery is going to be before the surgery, because with the surgery you lose a lot of muscle mass. So I went for 4 weeks, and then I had the surgery at Monmouth Medical, and then after the surgery I went back to Twinborough for 4 more weeks of rehab. Well, it was interesting because he said because of the size of my leg, he would have to detach the kneecap in order to get the device in, and he thought it would work best with a robot. And I said, how does that work? He said, well, I control everything that the robot does, but it would be the same as if I was doing it myself, but it's very precise and you don't have to worry about it. So I was not concerned at all, but he did explain it very well. The surgery itself went perfectly. I was supposed to be there one night, but they start the rehab in the hospital a couple of hours after the surgery. They get you up and they take you to the rehab room, and they start you walking and exercising right away. Oh, I feel fine. It's like I never had it. The only thing I haven't tried to do is run on it. I don't want to test it, but certainly climbing stairs or walking normally, I have no problem at all. No pain, nothing. Very often, the rehab is much worse than the surgery itself. I wasn't worried at all about the surgery. Unlike Suzanne, I've had many surgeries in my life for different things, so it was not a new thing for me. I was more concerned about the rehab, but the way it was done, it was great. And as far as pain is concerned, Dr. Chalnick said the same thing for 10 years when he was giving me the shots. He said, when you can't stand the pain anymore, then we'll know it's time for the surgery. And that's what happened on the trip. I couldn't stand the pain anymore, and that's when I had the surgery. So I would say, if you can bear it, that's one thing. But if it's really excessive and it really hinders your life, take care of it, have it done, it's worth it. And that's the advice I would give to any patient. It's definitely better than the pain which hinders your life.